Hi everyone, this is Neel Raithatha, consultant audiologist and director of WAXscope. Thank you for joining me in my latest video using the WAXscope. And we have here a patient who presented with a blocked right ear. Now they underwent ear irrigation a couple of days previously and they were advised that the procedure was unsuccessful, as you can see, because the wax is still present because the wax is too hard. And the patient was recommended to use some olive oil, softening drops or spray for a week and return back. Now, post-procedure, this patient developed severe otalgia in their ear, and you're going to see why once I remove all this dead skin. So this is not technically earwax. It's mainly dead skin. Now, the majority of earwax is actually made up of dead skin, around 60%, but I will say this is a far more high keratin content. So keratin is a protein that's found in dead skin cells. And you can see there's a few hairs matted here. So the pain was so bad for the patient that they visited an emergency walk-in clinic, and the doctor advised that from what they can see, they don't have an infection, because this patient was worried that they developed an infection post-irrigation. And so the doctor just recommended to continue using the drops and return for their irrigation, which technically, if you're suffering from otalgia pain, you shouldn't have your ears irrigated anyway. It's a contraindication. So I'm just removing this plug here. You can see the outer layer of skin that's just recently shed, that's enveloped the plug. Slowly but surely getting there. What you're going to see once I remove this plug is a puddle of water and oil, and because obviously the two don't homogenize, they don't emulsify, you're going to see the oil sitting on top of the water. In addition, the outer membrane of the eardrum, so the eardrum is 3-ply thick, the outer layer it's formed of the same skin that lines the inner 2/3 of the ear canal, so that's the epithelial skin. Then you've got the middle layer, which is a fibrous connective tissue layer, and then you've got the inner layer, which is made up of mucosal skin cells, and that lines the middle ear. So that's the eardrum in the distance, and it just looked abnormal to me. And you can see the oil to the right. We're going to zoom in a moment, so you're going to get a really good view of this, and the water is settled more inferiorly, so the two haven't mixed. So I'm just going to mop up near the entrance first. Now this patient's ear canal is slightly narrow, particularly at the entrance, and what I realised with this patient, the ear canal length was a bit longer than your normal. So the average ear canal length in an adult from the entrance where we're working on here to the eardrum is around 26 millimeters. But of course, there's individual differences. But this eardrum was a bit further in the distance. I'd probably say it's about 30 millimeters away. And this is where the zoom function comes in handy with the WAXscope. But it's not just available with the WAXscope. It's the zoom function is a facility that we have on our ClearWax app. So whether you use our endoscope or WAXscope, you've got access to that. So I'm just getting some of this peripheral skin out first, just so I can clear the way. And then I'm just going to re-enter the ear. So you can see to the right, when I get it in focus, there's some oil there. So at the moment, that doesn't look like a normal eardrum. But it's just because there's liquid settled on there. So in a moment, we're going to re-enter the ear. I'm going to zoom in. So I've just stretched the ear a bit more to begin with. You can see just how magnified that is. I'm just going to get it in focus. There's just a hair just in the end. It was there a moment ago, but I think I've pushed it away. So we're getting the water out to the left, and to the right is the oil. And then you're going to re-enter, and you're going to have another look. And that looks more like a healthy eardrum, although the outer epithelial layer of skin is slightly macerated, so that water has been absorbed by the hydrophilic epithelial skin cells, and it's caused that outer layer to kind of break down, if you like, macerate. Well, I hope you enjoyed that video, guys. Do take great care of yourselves, and speak soon. Bye.